This month is Suicide Prevention Month, an incredibly important effort to reduce the stigma around mental health discussions and encourage everyone to know the signs that someone you love might need some help. To learn more, we have UofL Health's Sameera Jackson here live in studio. She is a behavioral health outreach coordinator. Thank you so much for coming on, Sameera.
Thanks for having me.
We really appreciate it. Okay, so we want to start with those signs that someone might be contemplating suicide. What do you suggest that people look for?
Sure. A couple of things to look for are just statements. Is somebody making statements like, I feel like I'm such a burden. I don't want to be here anymore. What is my purpose? Also, you might see some behavior changes such as, and this actually goes for all age groups, withdrawing from other people, not wanting to socialize as much, noticing a change, whether it's their schoolwork, all of a sudden you're going from A's to F's, trouble at work, not being able to function like you did at work. And also little other signs that people don't think about, like if somebody's going around and saying goodbye to their friends and family, or even potentially giving a prized item away. And then in terms of moods, it's things like all of a sudden somebody's very depressed and they haven't been that way before. They're sleeping a lot, or they're sleeping too little. They're very irritable, or they're very angry. So those are some signs to look for, especially if these are things that you've never noticed before in that individual.
I can imagine you notice those signs, especially after hearing them. That can be really scary. What's the best thing to do?
I think the best thing to do, honestly, when you're speaking with somebody is just to sit at first. You know, you might have all these questions yourself, but you want that person to feel comfortable and feel comfortable enough to talk to you about it again. So I would suggest just being with that person and sitting with them, and then slowly and gently ask those questions. Like, instead of saying, when are you going to do this, or how are you going to do it, you can say things like, you know, what are some things that make you feel sad all of a sudden? I've noticed a change in you. So you want to have that conversation, but in a very gentle way, not to have that person retract and then not want to speak to you about it again.
And we know there's this new resource out here now, the mental health hotline 988, just a couple of months old. But how important is this? And what are the changes you think it'll make to improve mental health awareness and access to resources?
Oh, I think it's going to make a huge change. You know, most of us, when we're in a crisis, the first thing we think about is 911, and we know we can access different emergency services that way. This is essentially the same thing, but for emotional support or psychiatric needs. So this is great because you can call, you can call just 988. That's all you have to do. You can either speak to somebody in person, or if you choose, you can text with somebody or just chat with them if you don't feel comfortable. And what's nice is that until you get an actual appointment with a provider, you can still call this number every single day just to get some resources and to feel comfortable with what you're going through.
What an incredible resource. Sameera, thank you so much for taking time with us and focusing on this really important topic. We appreciate it.
Thank you.
We do want you to remember there's resources available 24/7. If you are ever in crisis, call that number 988. Just like she said, there is someone who can help. You are not alone.